This is the 1% Doctor, a podcast that takes you beyond the white coat, diving into unique stories and passions that drive top doctors in their specialties. We explore their journeys, what fuels their passion, and the human side of medicine, interviewing the best in the field to uncover what truly sets them apart. This is the human behind the doctor. And now, here's your host, Adam Lamb.
Welcome back to the 1% Doctor podcast. I'm your host, Adam Lamb. Today, we have a very special guest, Dr. Harvey Chip Cole. I know him as Chip. We've been friends for a long time. He's an amazing physician, plastic surgeon. We'll dive into the details of it. He's been doing this forever. He's one of the best in the country. And honestly, he's just a wonderful man. We've become good friends. We've worked together for a while. And I'm just honored to call him friend and also walk alongside of him and the success of his practice and the people he helps. It's a great relationship. And I'm excited to introduce him to you, the audience, because I think you're going to find a lot of value in Dr. Cole as well. Chip, welcome to the show. Thanks for being on here.
Well, thanks so much. I appreciate the opportunity. That's a kind introduction. And I'd also like to say I've worked with a lot of people, over my 40-year career, and you have been the most valuable, and I appreciate that.
Oh, that makes my day. That just got my Friday better. So thank you for that. That's awesome. And I'm going to help. My goal is to continue to help create more value and do that for you as well, because I really like our relationship. And again, there's a lot of people I get a chance to work with that are great. They're great physicians, and they might be great business people, but not always are like great men. And most of them. But that's one of the things that stands out to me the most about you is like you're a great man, and so I love being in your corner as well. One of the first things we like to talk about on the show is why, like you mentioned, you've been doing this for 40 years, right? Like you've been doing this for a long time. So let's go way back. When did you decide you wanted to get into medicine? Like what was there an aha moment? Tell us a little bit about why you chose to do that.
Sure. Yeah, no, that's a good question. It's always interesting to find that out about people. I grew up in Louisiana, and I had asthma pretty bad as a kid. And so I got, either weekly or sometimes twice weekly allergy shots. My mom was a head nurse at the Air Force Base, and the pediatrician there was a neighbor. And so even though he wasn't my pediatrician, I saw him all the time, and he was nice enough to let me go down there and get the shot so I didn't have to go to a clinic. So I always had kind of an interest. I liked the way, you could help people improve their lives. The pivotal event is I played all the sports, and back when I was in school in the 70s, you were allowed to play every sport if you were a good athlete. They didn't make you pick one like they do now.
Right.
And we're sitting in the bleachers at the beginning of football season, and this big defensive lineman, about 325 pounds, tried to just hop over me, and he kneed me right in the nose. And all of a sudden, I'm looking at my nose out of one eye, and I couldn't breathe. And and because of that, I had an asthma attack. And so it was quite the ordeal. To go from that and then going in and seeing a guy that could straighten my nose and fix it and help my breathing all at one time as a plastic surgeon, I was like, wow, this is cool. So that
How old
really
were you?
piqued my interest.
You're high school at this time?
Yeah. I was probably like 15, maybe 16. And then it's funny how things happen, when you're 16 years old and you meet this hot blonde girl that actually ended up being my wife.
Yeah. How long have you guys been married?
We've been married. Next month will be 45 years. So she's been through the whole deal with me, And
I saw the
it's
clip
cute.
note and
People will say a nurse and a doctor, y'all must have met at the hospital. I'm like, no, when she was in 7th grade, I took her to play putt-putt and she beat me.
that's so cool. It's funny, like my son who's 17, he'll be 18 this month. And like, he's dated his girlfriend since going into freshman year. And you know, they're awesome. They got a great, healthy
Yeah.
relationship. We love her to death. And I never thought I would be a fan of like that little high school sweet. I'm like, no one does
Right.
that. Definitely wasn't that. But
Yeah.
it's like, I want that for him so much. And that's what I love about your story of like even hearing you talk about your wife 45 years in, like you're always talking about her, like she's like some new girl you're dating. And I just think that's cool. And again, that goes back to like what I said in the beginning of like, why I think like you're just a great man, you know, like you're a good man, loves his wife, like that's a beautiful story. And I think we should all hope to have something like that, and versus what, you know, the media or the internet or something else might think you should have in a relationship. So I love that. It's a beautiful story. Not to distract from you getting
Yeah.
your
No,
nose.
I
Or the first
agree.
time I remember the first time punched in the nose, broke my nose. I was in a fight. I was a little bit of a riffraff kid. And I'll never forget though, it was a pivotal moment, probably not positive, maybe, but I remember in a fight, get punched in the nose, my nose was in blood, you know,
Yeah.
and the fight stopped for a second. And in my head, I'm like, I just broke my nose. But I was like, I'm okay. And
Yeah.
from that moment on, I thought I was the toughest dude ever. And I got taught a few lessons, but I also think it might have gave me some courage of like, just because you've experienced some pain doesn't mean you stop or quit. Like, because back in like when you talked about that, I can think of, I'll never forget the first time I got my nose broke. I was like, I broke my nose. And the guy who punched
Yeah.
me, I think he saw it. He was like, scared him. And I was like,
Yeah.
I'm okay. And I went right back at this
Yeah.
guy. I won that one. Sorry. It just reminded me of that. It was a funny story of my
Yeah.
school years. Nose gets broke. Doctor fixes it. And then is that when you decided you want to be a doctor? Or do you think you always knew? Did you always excel in school? Great
Well,
grades?
yeah, it was kind of funny. I was a little bit of a wild child like you, I think, and like to have fun. And fortunately, I didn't have to study much to make A's and B's in high school, and I didn't, you know. And so they had this test, an SAT test. I don't know if they still have it,
Yeah.
um,
I
I think
never took one, but they still have
yeah.
it. I was like, pump the brakes. I'm barely getting through high school.
Yeah, and so I took this test, you know, for college, and I think 30 was like a score where you would get like colleges offering you an academic scholarship and all.
Okay.
And I got a 33 on the test. I think like 35 was perfect. And so I got called into the principal's office because they thought I cheated. And
Okay.
And so that was kind of a good taste of, you know, you gotta stand up for yourself, and you can't let people dictate what they think about you, you know? And my mother is a little 5-foot Cajun, you know, dynamite, like a Bantam rooster. And she came into the office and she taught them a lesson for even insinuating that I cheated. And by the time we left, they were begging for forgiveness. But what was funny is it led to an academic, combination leader scholarship. I was like president of student government and football captain, all that stuff. So, you know, I got a scholarship, and when I got the scholarship, I thought, you know, I need to go ahead and go for it and see if I can do it, because I really never had studied hard. And so, and everybody told me, you know, you mess up your first year in college or your first year in medical school, you're in trouble. So I really buckled down and made, you know, straight A's through the first year. And then I got more serious. I started thinking about it, and all the, you know, it kind of, it hit all the boxes for me. I was very detail oriented. I like
Uh-huh.
mechanical drawing. I thought about being an architect. I like engineering, you know, and my mother's an artist, and you know, I would paint. So, and I did, you know, clay and sculpture. So it really fit very well. And you know, I
So did you
didn't.
always know when you decided to do medical school, did you know you wanted to go down the specific path that you're on today? Or Did you have to kind of discover that being possible throughout the pop?
Yeah, that was definitely a discovery process, and a big believer that God has a plan for you, and sometimes you have to just quit resisting and let it.
That's right.
And in medical school, the first decision you have to make is, do you want to go a medicine route or surgery? And I knew it surgery. It just fits my personality, my skill set, everything. And then because, I was dating, I got married kind of early. I got married my second year of med school. We had an elective that we could do. And so I looked at the electives, and the only elective that had Friday off was ophthalmology. And I'd never been to the eye doctor in my life. But I was married, and the beach is about 3 hours away from New Orleans. I was at Tulane. And, uh, and what happened was I fell in love with the microsurgery. It's what I call gentleman's surgery. It's all measured in millimeters and under the microscope. And it totally fit my personality. And I just fell in love with it. And so I decided I like the detailed microsurgery, but I'm not a contact lens glasses guy. So I started looking into different options to get to where I want. And to do facial plastic surgery, the best two routes to do it are either through ophthalmology and then you're an eye specialist and you do facial, or you go through ENT and then you're a nose specialist and you do face. But you have a true specialty orientation. And so I decided to go ophthalmology. Then I did the facial plastics route. And then after that, I did more cosmetic surgery training. So I actually have 4 board certifications. And so
What are
I'm
those?
quadruple board certified.
Wow. I don't even know if I've ever heard that said before. What are the 4 different boards?
Yeah, that's ophthalmic surgery is the first one. And then facial cosmetic surgery is the second one. And then laser surgery is a third one, and then general cosmetic surgery is a fourth one. And they're all separate boards. You have orals and writtens and practicals, and colleagues have to see you operate and do things. You send in case studies and all your work you've done. So it's very highly peer reviewed. And then so from residency, then I did the facial plastics fellowship, and I did that at Vanderbilt. And the first year, you concentrate mostly on facial eye plastic work and things, forehead, eyelids, and things. And then the
Yeah,
second
what's
year,
the eyelid? Is that like the the
yeah, exactly.
friends?
Yeah, blepharoplasty is the technical term. A lot of people call it a eyelid job or eye tuck or something like that. And what happens is your face, there's a lot of areas where you really need to think of your face in units. And so you have a kind of the third, you have the upper face, a middle face, a lower face. And then within that, like for instance, the brow supports the upper lid, very similar to like a curtain rod in a curtain.
Yeah.
And so a lot of people, kind of rookie surgeons, will make the mistake where if they don't have the training and knowledge and background, they'll operate on the upper lid, the brow pulls down, and then people look angry. And so I have people come to me all the time and say, I had a blepharoplasty and I feel like I look worse. People ask me, why am I okay? And what happened was the space from their brow to their eyelashes decreased, and it makes them look stern. Yeah,
That's
like
interesting.
they're frowning. And then the same thing on the lower lid. If you don't realize that the cheek is supporting the lower lid and you do a lower lid blepharoplasty and you don't stabilize the cheek, then the lower lid will either pull away from the eye or it'll pull down and have a puppy dog look. And
I even think, and you maybe my thought on the Botox side too, of like certain, I get Botox done here and there. I'm probably close to due, but like
sure.
certain areas, because if you don't do it, you do it somewhere, not do it somewhere, like you could maybe like get a droopier brow. Like, I mean, does that even happen on that kind of
Yeah,
that?
absolutely.
Just because they know how to inject doesn't mean they understand the full
Yeah,
structure
that's
of.
an excellent example because what happens Like, for instance, dermatologists, are very good with the skin. Unless they're surgical dermatology, they do cancer and Mohs reconstruction. They don't work and see those muscles, but Botox, you could think of it like a seesaw. It's all about balance. And Botox is technically a muscle relaxer. So, for instance, when people are trying to raise a brow a little bit with Botox, there's a muscle that pulls the brow down underneath the brow, and then the muscle that pulls it up is like just like suspenders up above the brow and the forehead. So you relax the muscle that pulls the brow down, and then just like the seesaw changing, then your brow pulls up. But you've got to understand the muscle dynamics to be good at that, or you get what we call in the business a spot brow, where you see people with those angled brows. That's not
Mm,
natural. That's because their muscles are out of balance.
interesting. Yeah. And
And that's
so,
usually because of Botox.
and you do a lot of different things. There's a lot of options on the face. You specialize, more specifically with facelift stuff, but you even have like your own, like you've developed like your own way of doing it, or a patented way. Like
Yeah.
talk to, I know that you have something, or like it's the scarless, or I know that,
Yeah.
I don't know
Yeah.
specifically, but I know
Yeah.
you
No,
have a
yeah, it's called the inside out, but I'll explain it. Let me back up for a moment because it ties together with when I was at Vanderbilt and doing my research. The first day I was there, I saw somebody with a brown recluse spider bite, and they had necrosis of part of their cheek. And then I saw somebody with it on the arm, and there's no treatment for it. So that really piqued my interest. And so went out, I did this massive research project that we went out like Ghostbusters at night and would catch brown recluse spiders. They'd
wow.
have these little cabins in the Tennessee mountains. And then I'd take them back in the lab and I would dissect out, just little microscopic surgery with venom sac. And then I took the venom, I injected into rabbits. And then it caused the same reaction in rabbits. And then I took, histology and the tissue and examined it. And then that allowed me to create an anti-venom. And I created an anti-venom, and I went to some of the drug companies. I thought, wow, I'm set for life. I'll never
Yeah.
work again. And they're all like, this is unbelievable. This is miraculous. But we did the research, and there's not enough people that have brown recluse spider bites that makes it profitable for us to produce it. And
Yeah.
that was my first touch of
Wow.
business medicine.
Didn't know that about you. That's pretty cool. How old were
So
you when
a
you
lot,
discovered that?
yeah, a lot of people call me Spider-Man or the Spider Doc, and you
I
know,
love.
and I'll get calls from Korea and things like that. So anyway, so I really became an expert on scarring and how to control it, prevent it, modulate it. And so as I went into practice, I was very fortunate. In about 1990, the endoscopes and the lasers were in their infancy. And I saw the potential. And so I got real involved with that and worked with several companies and taught for years and things like that. And, what a lot of people do on a facelift is number one, they make the incisions where you could see them. They say they're hidden in the nooks and crannies. Yeah, but if you look at their ear, you can see the nooks and crannies. Or you see ladies that pull their hair up when they want to dress up in a ponytail and all, and you see scars behind their
Yeah.
ears.
Yeah.
And so I started thinking, you know, you're going through the tissues from the external approach. You're going through two or three layers to operate. When if you went through the mouth, it's right there. You're just going through one layer. And
Mm,
so I started in the anatomy lab studying cadavers and things to try to figure out a way, almost like a backdoor approach.
yeah.
And so I figured out this technique that I actually trademarked it because it's so unique, called the inside out approach. And so I'll go in the temple hairline, I'll go in the mouth, behind the eyelids, through the nostrils, and behind the lower lip, and right behind the earlobes. And I could go all over your face with an endoscope You can't even see it. You can't even tell I've been there.
Wow.
And so it helps with all the deep tissues, but what it doesn't help with, it's like if you made your bed and you left the cotton sheet on your bed, you really need to go get a new satin sheet and put it on and make the whole thing look good. And so laser resurfacing does just that. It gives you a fresh layer of skin. That combined with the deep work that I do, I'm able to give the results that people give with the old fashioned surgery, up to a certain extent. I mean, when people hit, say, 70, 75, there's too much skin. You have to remove a little bit. But all the younger people, people are now doing this kind of thing in their 30s, to probably in their 60s. They can all do this inside out technique with no scar.
Wow. And how long have you been doing the inside out technique?
I've been doing it for years. I've been teaching it a long time, but I haven't marketed, or done any of that. And what tends to happen, unfortunately, with physicians, you see this, physicians treat their patients fantastic, but they treat each other poorly. Go play golf and have lunch together after they just suit each other, but they treat all their clients poorly. It's just the opposite. And so I started seeing all these physicians, doing techniques and saying things, which is what the thing I invented, and calling it different names and putting a proprietary name on it. And so I thought, I need to start marketing a little bit and get the truth out there. And so that's what I've been doing lately.
Okay. And how many, you've been doing this for a long time. How many facelifts do you think you've done? Do you have any idea?
Yeah, I figure I've done probably about 3,500. If you're busy facelift surgeon, you're doing 100, 150 a year. There's a lot of people that do 10 a year. And one thing that people don't understand very well, they hear the term like board certified, and they think that's all they need to do is go to a board certified doctor. But you really need to know their training because, for instance, a general plastic surgeon is just that. He's a general plastic surgeon. He has no fellowship training. He's done a residency in plastic surgery. So in that residency, he might have watched one or two facelifts and never did one himself. And then when he goes out, he supposedly is the board certified plastic surgeon that can do your surgery, but he has no experience. And so he's taking weekend courses and things unless he's serious. If he's serious and he really wants to be a face specialist, then he'll do a fellowship like I've done, and he'll be a face specialist. But most of those people, they do what I call the 3 Bs. They do boobs, bellies, and butts.
Yeah.
And that's all they do. And then, like, if somebody goes into them to have their face or eyes done, they'll say, yeah, we can do that, but you might want to consider getting your boobs done first. They'll try to just sway you because it's the hammer and nail thing, Whereas I let people know I'm neck up and I'm a super specialist in the mid-face region. And so I give people what's best. If a filler works, I give them a filler. If they need surgery, we talk about that. Maybe they only need laser.
Yeah.
There's a lot of bridge procedures.
Did you ever do anything below the neck or not really?
No, I never did. I got certified in it and I studied it just because I wanted to be knowledgeable and well-rounded so that I could advise and help, patients kind of what they need. But I don't do any of that.
Yeah, I know. I remember you and I were talking about that. I have a deviated septum and at some point I need to go get that done. And yeah, I was like, well, maybe we can make my nose look a little sharper. And I remember you and I talking and you gave me some ideas about, hey, have they had this kind of fellowship? And we looked the guy up and
Yeah.
he tested. And I know him personally as a good guy, but again, I don't know him in the depth of professional,
Right.
that you can look at. Right. And so I think for somebody that's considering, especially your face, it's one thing, especially with a joke, my wife and I were talking about some of the pants these women wear, like compression, like where, you're like, wow, it's got a good butt. Like, and then all of a sudden, if they take those off, there's these videos you can see on YouTube and you're like, what? Like, it's totally just, you can't do anything. You can't do that to your face. You know what I mean? You can stuff a bra or you
can't hide it like your body. Yeah.
Yeah, women have been doing that for hundreds of years, but when it comes to your face, like, it's it, man. Like, that's
Yeah,
and so I think it's, so important to actually know what you're doing, and I think the other part when it comes to that too is from a cost standpoint of, like, for me, I'm not looking for the cheapest face surgeon out there,
right.
but there's a lot of people that's where they look at their value, right? They'll go drive a nice
Yeah,
car, but want the cheapest surgeon, and I'm like, "That doesn't make a lot of sense."
right.
So that's an interesting aspect of it, and you get what you pay for.
Well, it's really funny. I usually, very quickly either jive with a patient or I don't. And so most of the patients I get along very well, and then we'll go over things. And then of course, their husband's sitting over there in the corner, or he'll come later. And a lot of times they're like, how much does it cost? And a lot of times I'll answer like the husband, I'll say, actually, if you think about it, it doesn't cost anything. It's an investment. But if you don't do it and you don't do it right, that costs you a lot. That costs a lot of grief. You have to have 3 or 4 procedures when you could have had 1. And I just try to plant the seed of how they should think about it, you know?
Mhm,
It's
mhm.
like you said, you can't hide your face. I've got 2 brother-in-laws that are dentists, and I tell them all the time, I'm like, "You don't have to do good dental work. All you have to do is make it painless." They have no idea if you're a good dentist or not, you know? And I say it tongue in cheek, but it's true.
Yeah.
And, unless your tooth falls out or something, you could be a pretty average dentist, and they think you hung the moon. But you can't do that with your face.
It's funny, my wife and I, we have a neighbor friend of ours, they're probably in their 60s, you know what I mean? And but out along the line of that investment. But, like, this woman is beautiful, like,
Right,
she's done something, I don't know what she's done,
right, right.
and she takes care of herself, and she's, like, the sweetest. I mean, I like, she's wonderful, but my wife and I, we see her, and my wife's like, "Hey," like, that's the new standard, right? Because like,
Yeah, it's attainable.
I'm sure she's had a little something, I don't know what, but
Right.
but it matters, like you said, the investment of, the husband, he's a dude, he looks fine,
Yeah,
but his compared to like, his wife is smoking hot, and she's
yeah, oh,
a
yeah,
wonderful
yeah,
there's an energy, right? Like, when you feel beautiful and when you feel
right,
attractive, she's one of the sweetest, friendliest, nicest people in the entire world. Her and my
right.
wife were talking about rescuing pets together, like, I mean, just wonderful,
Yeah,
wonderful.
yeah,
Part of it is how you feel about yourself.
yeah,
And that's where, I think it's funny that insurance will cover antidepressants and they'll cover maybe some fat loss medication. But imagine the depression, the change, the confidence that changes
right,
when somebody has something change for them that they like. Of course, some people there's a vanity aspect of it. And, I don't know if there's any, I like nice cars, right? So someone could look at
right,
me and my Lamborghini and think, oh, it's a vanity thing. Well, it's not. I mean, I don't feel like a loser in my Lamborghini, but I like it
right.
because I love cars and the stuff and all these
Yeah,
different things.
yeah,
And so there's an aspect of it that I think is important of like, if there's something about your face you don't like, you can't put a mask on and go everywhere, right? I
yeah.
guess.
I mean, it's your calling card, you
Yeah.
know? I mean, when people meet you, I like a common phrase, obviously, is don't judge a book by its cover. And I like to say it should be don't only judge a book by its cover, because everybody judges a book by its cover. It's
Yes.
human nature. Even animals do that. And, it definitely affects your mojo. I have had people come back and they're a different personality in their clothing and they've gotten in shape. And that's one of the reasons that I call my whole practice umbrella inside out balance, because I really believe that it starts from inside. And
Yes.
and for me, that's like faith and that's family, it's friends, it's all that. And then physically and all, you've got to take care of your diet, you've got to peptides, you got to do the things that you can do to feel your best and to be healthy. They're predicting right now that people that are alive, especially if they're less than 60, are going to have the choice to live past 120.
Oh, yeah.
People think, well, I don't want to do that because they've seen old people that hardly work. And I tell them, you're going to live that long, but you're not going to act like you're 120 if you
Yeah.
take care of yourself.
Yeah. I feel like, I mean, with, there are a little more aches and pains than I did in my late 20s, but in my head, I'm 28 years old.
Yeah, yeah,
And I'm going to run like that for as long as I can, but I'm also taking care of my health. And there's an
right,
aspect of it like, going to the gym and eating right. And, I don't drink alcohol, and trying to sleep is probably the thing that rest has become probably more of a focus than it's ever been in my life now. Cause I
right.
understand how important sleep is for the brain and for the body and for recovery and for longevity. But there's also a part of, there's just, gravity.
Yeah,
You yeah, gravity's still here. And so there's certain things you can from the inside out, like you said, on the inside doing all the right things, blood work's good, genetic test is good, methylation, looking at all these markers. But at the same time, if I'm like, I don't really like my face,
right.
fix it. Right.
Yeah,
And I think you're the best out there to do it and have that done, because there's just a part of that. Like, and then all of a sudden, we don't walk around naked all the time. We walk around with clothes on. Right now, you can see my hands and you can see my face, right? And
yeah,
so
exactly.
and so I think oftentimes people don't think about that.
Mm,
What does happen if this looks better? It doesn't, you don't need to look like, what my kids have, I forget what they do it to the cat all the time. But, like, pull it doesn't need to
yeah,
be.
they like to call it snatched. You know,
Yeah, just like,
you
yeah,
have
like,
to be snatched.
right, yeah. And so where it's natural looking, but you just look youthful, the skin, like, and then all of a sudden, how does that make you feel? How does that make you see yourself? What what opportunities do you say yes to? How excited are you to go to the thing versus like, oh, I don't want to go there. Yeah, like that's going to be a bunch of younger people. We're like,
Right.
can't wait to be around these younger people that look better than, like there's a different energy that comes with it. And I,
Yeah.
I love that part about the cosmetic surgery space for people.
Well, and you also kind of allude to something that's very important, which is the mental health, the psychology of it.
Yes.
It affects how you look at yourself, how you treat other people, and it really does bring out the best in people. Because when people look better and feel better, they deliver better energy. They say
Yes.
nicer things. They tell somebody hello and look at them in the eye when maybe they didn't before. And
Yes.
there's a lot of that, and I have I teach. I'm a fellowship preceptor through Vanderbilt, through their program, and some of the younger docs, when they're doing their fellowship training, they'll come spend time with me, and so I try to not only teach them surgical technique, but teach them the things that you don't read in the book. How to treat people, what to look for, why are they feeling a certain way. And, one thing that I like to say too, you're talking about gravity is I tell people everybody knows the saying, the devil is in the details, but they
Yeah.
don't realize that the details are gravity. And so the devil is really gravity. It's working against everything that you're working for.
Yeah.
And it's like a hammock, you can have a perfectly brand new hammock, and after a couple years, you gotta tighten it a few links if you want it to stay a great
Yeah.
hammock. It's the
Yeah.
same
No,
thing. There's
that's a great analogy.
ligaments and things in the face, and you have to tighten the ligaments just like you're tightening a hammock.
Yeah. No, that's a great way to put it. And I think also, you tell me, this is more of a question. You mentioned people are doing it in their 30s, even now, or before, maybe it was in later. Like, is there an aspect of this that doing it sooner, you don't have to do it later? Like, you
Mhm.
don't have to reverse things as much. Like, is that
Right.
something that you see more
Yeah,
of
no,
too?
that's a great question, and that is something that, kind of the old wives' tale thing that's been passed for generations, and so I tell people, the younger you do it, the better your tissues heal and the longer it lasts. And so, what I mean by that is when you think about an aging timeline, we can take you and we can move you back on the timeline, but we can't stop the clock. And so you will still age. But the beauty is when you're 100, you only look 85 because you keep the benefit as you age chronologically. And so if you do it earlier, then you have a less amount to do in the future to keep it tuned up. I like to do a twist on a Bible verse. I call it sow as you grow and no one will know. And basically, I also call that the Michelle Pfeiffer rule. You know, Michelle Pfeiffer has looked great for years and years and years because she's done little tweaks. It's the same thing with Jennifer Aniston. They haven't done a dramatic thing, but they've maintained their looks. And, if you go back and look, you can see when they've done certain things. I could point it out to people, but that's a smart way to do it.
I love that. And that's, I think, the philosophy my wife and I kind of have in our house is like, if it's going to make you feel better, get it done, like
Yeah.
versus something later that might be drastic, whether, like for me talking about getting my, I have trouble, I have to do nasal spray. Like I'm at that point,
Yeah.
right? So it's like, there's a health part of it, but I'm like, well, if you're going to do it, maybe we do a little reshape of the nose without me looking like a snob. Like, all right,
We'll make it
as
more
long,
functional. Yeah,
and then maybe
absolutely.
I like that, and I feel younger, and because I feel younger, I'm more likely to go do things that, I just there's a difference, the confidence and all those kind of things, and so we believe in that of like, hey, if there's
Yeah,
something that you want to, like I think she did like a bluff thing, and
right,
great, but you have to do the other work. My wife still goes to Orange Theory
right,
at 5 a.m. every day, so like she's still next to she's still watching what she's still getting her hydration, like inside out. You got to work on the whole
right,
thing.
right.
Spiritual, the whole 9 yards. You can't just fix one thing on
Yeah,
the outside because the inside
yeah,
is gonna fight against you. So,
yeah.
I love that. It's a beautiful philosophy, and if someone were interested to working with you, finding out more, what would be the best place? And we'll put all of Dr. Chip Cole's information in the show notes, but where would someone wanna come find you?
Sure. Probably the easiest is my website, which is at Oculus, OCULUS, plasticsurgery.com. OculusPlasticSurgery.com. And then also I have an easy area code uh, reference. If you can remember 404, which is the Atlanta area code, 404, the number 4, and then spell Dr. Cole, DRCOLE. And that is 404-437-2653. I call that my Batman doctor line, hotline.
Right. That's awesome. Well, thank you for being a guest in the podcast. Thank you for being a good friend, and a great man. I think this is going to be very valuable. Thank you to all the listeners for sticking with us, listening. I hope this is super valuable to you. And as always, please like, subscribe, and share this with your friends, the 1% Doctor podcast. Any last words, Dr. Cole, before we hop
Yeah,
off?
what I agree with what you said, but I also would like to offer there's a lot of young physicians that are searching and trying to figure things out, and they need to align with somebody that has worked with a lot of doctors, has seen a lot of issues, and that's the kind of thing that you don't learn sometimes until it's too late. Usually young docs make a mistake or two, and then they look for somebody like you. And so I would offer myself as a testimony that I've done this for 40 years and I
Mhm.
have sought you out. And I think also I want them to know if they want to talk to me about what they can do, or they're making a practice decision, or they're thinking about specialization or buying a
Yeah, there's
certain
a lot of
laser.
young
Yeah,
docs listen to thinking about their path. I think
exactly. And I'm
great.
happy to play that forward.
I love that. That just goes to show. Like I said, you're a good man. He's a great man. Reach out to Dr. Chip Cole. Whether you need help, you have people fly in to see him from all over the world because he's world renowned in his specialty that he does in the face, and also he's a great man and a powerful educator. So if you're a doc and you're listening, we'll have make sure that contact information's there. So thank you again for being.
The very last thing I have to say, because of your reference about people flying in from all over the world, I like to say it doesn't matter if your destination is heaven or hell, you still have to go through Atlanta to get there.
Yeah, that's right. That's right. The Atlanta layovers. We know those.
That
I try to
airport,
avoid.
something
Right.
else.
It's there.
All
All right.
right.
Well,
Well,
thank
have a
you for
good
being
one, Adam.
guest.
Thanks for having me on.
Appreciate you. Thank you guys this is the 1% Doctor Podcast. I'm Adam Lamb. We will see you next time. Thanks so much for tuning in to this episode of the 1% Doctor. Please be sure to subscribe to the show where you're able to consume more podcasts, get more value, and learn more about doctors potentially just like you. Please tell a friend, review the show, and we'll see you in the next episode.